this. Oh.
Evelyn, why so serious?
Because I'm in class, and why are you late?
Because we were trying
It
to
started
get
at
a room.
11:30. It started at 11:30.
I know, and we were trying to get a room, okay?
Okay. I only have 20 minutes on this session.
I was gonna go over today over cardiac, endocrine, musculoskeletal, and somewhat burns. And then tomorrow I was just gonna go over renal, respiratory, and the ones that are in blue.
So today you're gonna, okay, that's fine. Annabelle, were you able to print this for me again? Annabelle.
No.
Is she there?
I have to check to see what time she's getting here.
Oh.
Okay. So from the cardiac, you guys have to know your right and left sided heart failure, because that one does show up on ATI. I wouldn't focus too much on like how, you know how they have like the blood flow, like where it goes and everything. Not the, like, I wouldn't focus on all this stuff, like the right atrium and all that. You do have to know your mitral, where it's at. Sometimes they call it apex, mitral. You have to know that one. If you can, you know, this the mnemonic, the All Peoples Enjoy Times magazine, that's important to know, because sometimes they'll ask where Erb's point is at, and that's on the third intercostal space, you know, like the second for aortic, you know, and all that. So that's important to know. ATI, they sometimes ask about the S3. And that's the it's an abnormal what's it called, ventricle filling. So this one you do have to know, because that one does show up on ATI. This one doesn't. I want to say I haven't seen too much EKGs, but it'd be nice to like kind of go over them. You guys can, especially ventricle, this one, cardiac. Okay, so for the signs and symptoms of right heart failure, left side heart failure, you think of like fluids backing up into your lungs. If you guys like know have an idea of how the blood flow goes in the lung, in the heart, and how it goes through the lungs and all that, if you can think about like how if there's a backup of fluid going back into your lungs, then you can kind of have an idea that, you know, the patient is going to have difficulty breathing because the fluid is in the lungs. Well, the blood is pulling back in the lungs. You're going to have like orthopnea, a blood tinged sputum, and crackles. Those show up on ATI as left-sided heart failure signs and symptoms. For right-sided heart failure, what I've seen on ATI, we do have swelling of the legs and hands because there's a backflow of blood to the right side of the heart, and that blood goes back into the body. So when you think of right-sided heart failure, think of just like a backflow of fluid going back to your body. So that could be like your upper, like your legs, right? And then if you have fluid going or blood pulling back into your body, you have like weight gain. That one does show up on ATI. Edema shows up on ATI sometimes, and JVDs, large JVDs show up because like your necks are so distended because of the amount blood flow that you have going back into your body. And they do have sometimes ascites and splenomegaly. These two sometimes come up because you're having all this like blood flow going back into your body. So now your organs are like kind of like absorbing all that blood and like they're getting bigger. Like your liver gets bigger, your spleen gets bigger, and so just all this like all these organs are just being filled up with like blood and they're getting all big. So those are, I want to say those are like the words that I've seen from ATI that describe those signs and symptoms. You do want to know your BNP for heart failure for diagnostics. The BNP is the amount of blood that your left ventricle your left ventricle pumps out to like the rest of your body. If that BNP is low, then the amount of blood that's pumping out to the rest of the body is not like doing it adequately. So now you're getting like a pulling of blood in your left ventricle. So this would be important to know, at least, like pertains to the heart.
Wait. For the BNP, I have a note saying that if it's low, if it's under 100, there's no heart failure. From 100 to 300, it's present. Above 300, it's mild. Above 600 is moderate, and above 900, it's severe.
Above 100 is abnormal, right? So so as long as you know that's above 100 is abnormal, you should be fine. Because you want to keep it low. That way you don't have that pulling, of the blood in the right ventricle. Echocardium is also important to know that it pertains to a diagnostics that you can take for heart failure. You want to make sure you report any edema, weight gain for those that have right-sided heart failure, because you're getting all this blood flow back into your body. So you want to make sure you're assessing for any weight gain, of like 2 or 3 pounds. You want to monitor, their intake and output, their weights, and edema. But that 2 or 3 weight gain is important to monitor for. You do want to make sure you guys have them on sodium, fat, and cholesterol, especially sodium. Sodium does come up on ATI sometimes, so sodium restrictions. You want to elevate the head of bed semi-flowers, or as long as you elevate the head of the bed, that should be fine, just so that way they're able to breathe, considering that they have, either difficulty breathing because they have fluid in their lungs, or so let's see. The second heart canning to decrease thirst is important to know. For coronary artery disease, there's 2 that you guys have to know. The ischemic one that we went over, I think it was this term. Ischemic is like there's a narrowing of the blood vessel because there's like plaque in there. So when there's a plaque in there, like there's right here, you have inadequate oxygen, to the heart. So now, that can cause angina pectoris. That can cause myocardial ischemia. In general, you just want to make sure that you want to eat healthy, exercise, no smoking in general for anyone, you don't want to drink alcohol. You want to make sure that you are having your blood pressure within normal limits, which is 120/80. You want to make sure that your cholesterol levels are within range, your LDLs, your HDLs, total cholesterol level, and your triglycerides. It's important to know your statin medication for this one. Statin does show up on ATI, and the way I think about statin is like, I don't know, well, I think I might be wrong, but like, I mean, just the way I think about it is back in like a long time ago when there was like wars going on, and like there was like Russia and all the other countries, and they had like alliances and stuff, and there was like this dictator. I think his name was Statin, or it sounded something like that. But I remember of him like being chubby and like that because he's a dictator. And so when I think about him, I think about him trying to lower his cholesterol level. So, he has to have below 200 cholesterol level. Make sure LDLs are lower than 100, HDLs higher than 60, because those are the good ones, triglycerides lower than 150. And so that's how I think about that. Statin medication, you want to make sure that that you have to report any like muscle pain. You want to take the medication in the evening or at night. No, you don't want to take any St. John's wort or grape juice. And you want to monitor your liver. So when you think of liver, you think of like all the diagnostics tests that you want to monitor for. So you want to monitor for your ALT, AST, any jaundice, any yellowing of the skin. Yeah, so statin would be given for somebody that has, ischemia, because they have, plaque in their blood vessels. Right? Yeah, so those you want to know, but definitely know, your LDLs, HDLs, cholesterol levels, all of that. Peripheral vascular disease, this is important to know. This does show up on ATI, and it did show up last night when we were talking about it. There's a video for Simple Nursing, and he explains it like really easy and simple. But you want to know the signs and the differences between both of them, and their treatment for them. So peripheral artery disease, so this is where the oxygen can't get to the hands and feet. So that can cause necrosis of the extremities because the tissues die because there's no oxygen leading like to the tissues. So the patients will have sharp pain and intermittent claudication. That the intermittent claudication that does sometimes show up on ATI, but the sharp pain does as well. So you want to know those signs. The pulse would be very poor or absent. That does show up sometimes on ATI. And the temperature would be cool. It's not going to be warm, it's going to be cool. The patient would also have pale, hairless, dry skin. And that's important to know. Tissue death, which is necrosis, that can happen. Oops, sorry. And so the treatment for this would be to dangle your legs, because you want to make sure that the blood flow goes and reaches your extremities. So that's important to note because those do show up on ATI. For PVD, this is where the blood flow can't go back to the heart. So now you're with this one, you're not gonna get any pain. It's just it's gonna be dull. Pulse may not be palpable, so that's important to know for ETI. You do have edema in the leg that does show up on ATI, and the warm legs that does show up on ATI. The brown and yellow color for like their skin that does show up on ATI. The treatment would be, you want to make sure that you elevate the veins or elevate the extremities, so that way oxygen goes back to the heart. So that's the treatment that you want to know for this one.
Okay, Emily pointed out something.
Yeah.
So for PVD, we elevate. So our little V is up.
Yeah.
And then for PAD,
Yeah.
so it's down. Yeah. So,
Yeah.
just wanted to show that.
We're in a game.
No, we're not.
It's fine. No, yeah. Make sure you guys, know how to like the treatment for both of them, how to, do that. Side note, for a DVT, use a Doppler to assess for any DVTs. So that's a side note right there. So you want to make sure, no smoking, no high cholesterol, all, you're just want to make sure you're a healthy individual, no alcohol. Statin is another medication that you can take. For the treatment for PAD, I've seen on ATI, you want to make sure you don't put any tight clothing. No tight clothing on. Dangle, your arteries or in a dependent position, like how was stated yesterday during, class, the dependent position. Stop smoking. No heating pads. That's important to know for those. So here's that. Angina pectoris. So there are two types. They're stable and unstable, and this is important to know because we do have the nitro that's given for them, and for stable angina, we would give them the pill. So we would give them the pill that you administer every 5 minutes, and you take the first pill, it's sublingual, and if the pain doesn't dissipate, it doesn't go away, so you call 911, because in the meantime, while the ambulance comes and gets you, by the time you get to the hospital, you would already be taking your second and third dose. So that would be for stable. Unstable would be the patch where you put it on the upper area around like your chest. It's not a PRN med, it's once a day, and you want to make sure that you put it in the clean, dry area. You want to make sure that you don't take any AFil medications, like medications that end in AFil, like Viagra, because that one does lower down the blood pressure significantly. And because nitro already lowers down your blood pressure, if you're taking medication that ends in AFil, then it would just like lower down the blood pressure even more. So that's one thing you don't want to be taking. You do want to know the signs and symptoms for angina and how it did. On ATI, I think, I can't remember if they ask if it's the difference between, if they state if it's a male or female, but I believe for males, you do get like the chest pain and you get the shortness of breath, the diaphoresis, and then for females, you get more of like nausea and vomiting. And if somebody has epigastric pain, you want to assess for it because sometimes they can have like GERD or they can actually be having some sort of like angina or pain. So that's important to know. So make sure you know your vasodilators, which is your nitro. No drugs ending in acyl for nitro. Calcium channel blockers. You do want to make sure you know that medication. For this one, there are a couple that do show up, and some end in Zem, Dipine, and Amil. Those are endings for calcium channel blockers. Sometimes they do show up on ATI, mainly Dipine. I've seen Dipine a couple times. That one does show up on there. Beta blockers, you want to know, like the ones that end in LOL, they lower down the blood pressure. So you want to be careful with like the orthostatic hypotension and your heart rate. It lowers down your heart rate as well. Antiplatelet, anticoagulant, like your heparin, your aspirin, an antiplatelet, enoxaparin, I don't know how to spell it. Spelled it wrong. But that one does.
Teacher question.
Yes.
Does warfarin thin out the blood?
It prevents I believe it's platelet formation.
Oh, okay.
Like your aspirin and your what's it called? Clopidogrel, those are antiplatelets. So aspirin and
Okay. Thank you.
And then sometimes on ATI, they always have this one question where it's like a patient is asking why they're given heparin and warfarin like together. And that's because heparin has a faster onset and warfarin has a slower onset. So they give heparin to start, to start that in the meantime while warfarin reaches its effect. So once warfarin reaches its effect, then they stop the heparin.
And they taper it off, right? The heparin?
Yeah, like
they don't just abruptly stop, it's tapered off. I think I do remember that question.
Well, the answer what I always selected for that one was that heparin is given because it has a faster onset, and then warfarin is given once warfarin reaches its therapeutic level.
Okay.
And then they stop the heparin because they would already be on warfarin.
Okay.
Myocardial infarction. So you want to know, this is when you're having a heart attack, and it's caused because you have like the plaque, the osteoporosis in the arteries, and they become narrow. When they become narrow, the patient doesn't get enough oxygen. So this is what causes your pain, your angina, because of the low oxygen. And so now you have like plaque rupture, it's becoming blood clot that blocks the arteries of the heart. You want to know the signs and symptoms. Left arm pain does show up on ATI. Heartburn does show up. The shortness of breath does show up. Nausea and vomiting for sure, and sweating or diaphoresis. I believe mild and back shoulder does show up, I've seen on there. And okay, so this is where they have the signs and symptoms for women, and that would include fatigue, shoulder blade discomfort, and shortness of breath. For men, it would be left arm pain, mid back and shoulder pain, and heartburn. And you want to make sure that they are placed on an EKG as soon as possible. You want to know their troponin. I would just like on ATI, I've seen troponin stated as like it's like the lab value you want to check to see if they are having an MI. So that's the one that you want to make sure you know to check for if the patient's having an MI. The stress test is also done, which is where like I think this one is where they walk on the
They
treadmill.
run in place or walk. Yeah.
Okay, so that one. Oh, and then on ATI, it's like you have to wear like some shoes, like some walking shoes, to make sure, you know. And make sure you guys know your ST elevations. That's what's gonna show up on an EKG. Yes, this one, the treatment for Mona. Okay, so you know how Mr. Chris, he mentioned that it's morphine, oxygen, nitro, and aspirin. So on ATI, there was one question, and I asked which one you would give the patient first, but I think it was morphine. I put morphine, but it said it was wrong.
Yeah.
And like I don't know. I think it was
I thought that was wrong.
yeah, I think it was from Simple Nursing, and like they recently changed it though. Like the order was administered.
No.
I don't know. I forgot how, but there's a different
Didn't
order
we get
to
the
it.
question in ATI?
Yeah, it's a practice.
They put oxygen first.
I don't know so that's where I saw it. Because I did Mona as well, and it was wrong. The last one was morphine. But I can't recall if it was oxygen first. I want to say oxygen first because their justification was airway circulation. That makes sense, but then we've always gone.
Yeah, on ATI, I mean the answer was oxygen on ATI, so I mean it does show up. If not, does show up on the oxygen. But I forgot where I listened to it, but like they said it was different, and they had like a different way of approaching how to treat this one. So I'm not too sure about this, but I know for ATI the answer was oxygen, the first treatment. You guys, heparin is given, sub-Q. So make sure it's given sub-Q. It can also be given IV, but on ATI they state sometimes like how is heparin given, and it would be administered sub-Q. Sometimes like for medications they give clot busters to open up, the right here because it might be closed, like and they need to open this ASAP. So then they would give a thrombolytic clot buster that ends in ACE. With thrombolytics, there are a lot of contraindications for it, and most of the contraindications for it would be that the patient can't have any history of consistent like like surgeries or high blood pressure or like increased cholesterol levels, or they basically just have to be a healthy individual to receive a thrombolytic. Let me see. They can sometimes even do an endarterectomy if they don't qualify for a thrombolytic. So sometimes they would, go in there and cut out the blockage. Let's see, yeah, so make sure you guys know your cardiac catheters, your cardiac meds, because those do show up a lot on ATI. So yeah, your troponin is important to know, because that would that would tell you like the protein release in the bloodstream when the heart is damaged. Your creatinine kinase is also important to know, but for ATI, troponin would be like the #1 lab that you would want to check. I haven't seen on ATI, like the ranges a lot, but I mean, if you guys can, it would be nice to like go over like the ranges for troponin and the BMP. I haven't seen them ask anything, but if anything, you want to make sure you just keep it below 100 for BMP. And you want to know that if it's like abnormal, then that is indicative of like a heart failure, because the left ventricle would be weak because it's stretched out so much that now it has like pulling in that left ventricle, that now you have a backflow going to your heart. So now you're gonna have dyspnea, difficulty breathing, and all that. Myoglobin and creatinine kinase. I'm not sure.
Teacher, can you repeat that? I missed it.
No, which one?
What you just said like a minute ago about, and that's why dyspnea comes in.
Oh, because okay, so in your heart, like, let me see if I can draw it out. I can show you this. Okay, so on my Zoom thing, it says that there's like 7 minutes left, but like if it happens to shut down, then I'll just try to like send another link to it, or if anything, I'll just like record it on my end and then I'll just upload it on YouTube, and then I'll send you guys the link for that. Sorry, I'm drawing up this thing really quick. Okay, so if you guys okay, so if you guys have your heart right here, and if you guys know that, how in the beginning, like we have the interior and the anterior vena cava, that bring blood flow back, to the heart. And the blood flow, like once it goes in the heart, it starts up here, and it goes like through these the right atrium, the tricuspid valve, and all that. So the blood flow goes all the way there, and then it goes in the lungs, where these are the lungs, where it gets reoxygenated, and it goes back into the heart on the left side, and it goes through all that stuff, the the ventricles, atrium, and all that stuff, and it goes through the aorta and back into the body. So if there's like an obstruction right here, if there's too much plaque, that blood flow that's going back into the body, that's coming out of the aorta, it's going back into the body. If there's an obstruction up there, the blood flow, that one's gonna go back into the heart, and it's gonna pull down here on this side, that bottom, the left ventricle part of the heart. So now this part of the heart, the right ventricle, that's very important, because that pumps blood all the way back to the body. And if that's not functioning, if there's like a blood flow here, if there's a pulling of blood here, then now it can't pump it out, you know, because there's so much, it's loaded up. So now this is gonna stretch out. It's gonna become weak, and now you can't get all that blood flow to going back into your body. So now all this blood is like here in the heart. So now think of like liquid being in your heart. You're gonna have difficulty breathing. You're gonna have wheezing or no crackles. You're gonna have blood tinged sputum. So anything that has to deal with like difficulty breathing. So now you're gonna have to like elevate the head of the bed because you want to make sure that they're breathing. So that's, well, yeah, I don't know if I explained that right.
You did, thank you.
So let me see. Hypertension is important to know. You know, obviously you want to make sure you know your normal range, 120/80. On ATI, they do ask, I think, about like pre-hypertension or stage 1, stage 2. So you want to make sure you know hypertension crisis is 180/120, and your stage 1 hypertension 140/90. I believe those would be like the ones that you want to make sure you know, because then if you know those, then you know what pre-hypertension is. It would be somewhere between 120 and 140. Systolic and diastolic would be between 80 and 90. So that's how you would know, you know, you would have an idea of your pre-hypertension. And then you would have an idea what stage 2 is if you know what your stage 1 and your hypertensive crisis is. So those 3 would be important to know. When somebody has, you know, hypertension, it does affect a lot of organs, because if you think about it, your heart is pumping out so much blood so fast that now all your organs, like your renal and you know, has an abundant amount of blood flowing to the kidneys, that it just puts a lot of pressure in them. You have visual changes. You have like neuropathy, like tingling and numbness of the fingers. You have you're more prone to having a stroke. You know, heart failure, you're more prone to having that. And visual changes like blindness. Blindness does show up on ATI. Neuropathy does. You're more prone to like strokes. So you want to know that hypertension is idiopathic, but there's like no known cause. You want to make sure that you know people that are African Americans, they are prone to having hypertension. That increases their risk for having hypertension. If you smoke, if you take alcohol, that's important to know. Or you have high cholesterol, too much caffeine, obesity, sleep apnea. So just in general, you just want to make sure, you know, you want to be healthy. You don't want to be doing all the drugs, all the smoking, alcohol, eating, you know, a lot of foods that don't have enough protein and nutrients. So yeah, you want to make sure you know that. Let's see. The signs and symptoms are asymptomatic for hypertension, so it's known as a silent killer. So you just want to know that it's asymptomatic. You do sometimes on ATI, sometimes they do mention, you know, headache. I think blurred vision does, I believe, come up sometimes. Make sure that you know how to take the blood pressure. You know, the arm is, you know, at the